changing the culture at the bedside and promoting sustainability of performance improvement. Teamwork, ownership, and feedback. Teamwork, you see around this table representatives from the various disciplines, the various floors. Ownership, everyone thought that this was their own job to assure that we became an infection-free institution. And finally, feedback throughout the program on a daily basis. We would give feedback to the staff at the bedside level. We observe people putting in central lines. We provide feedback as far as their compliance with the bundle. We sent out daily emails trumpeting this was the 10th or 20th day of being infection-free, and ultimately had a big institutional feedback when we hit 100 days of being a central line infection-free institution.
So what we did was, through the Department of Quality Management, we looked at setting up a system that could enforce accountability, communication, and structure within the entire process of central lines.
We came up with a CLBK, Central Line Bundle Kit log. This fostered communication between nursing and the physician, so that the nurse could be bedside when the physician was actually inserting it.
The nurses were present at the time of insertion and were empowered to stop the process if the sterile field was broken or any part of the process did not go according to policy and procedure.
A significant number of the infections that had occurred relatively late in the course. So one of the most important interventions that we made from the physician standpoint was really making sure that the line was necessary and getting it out as early as possible.
And especially the house staff, their involvement in terms of daily documentation for the continued need for a central line was probably one of the most important aspects of this performance improvement.
Our champions at the bedside are our nurse managers who embrace this program, took it individually on each of their units, monitored their staff, assisted in educating their staff. So truly we owe a great deal of success to the cooperation that we received from our nurse managers.
It's a credit to this institution that we were able to do this with such a wonderful collaboration between the physicians and the nursing.